Hi there, welcome back to another episode of The Cracking Yarn with myself, Sasha and
Sean Williams, Naturopath.
So Sean, firstly, before we get into today's video, which we're going to be talking about diabetes and kidney disease, where can we find you again?
So you can find me on Facebook. You can find me at Sean Williams Naturopath. I'm also on YouTube under the same name, Sean Williams Naturopath. I have a podcast called Interview with the Naturopath. It's available on all the major platforms. And I have a website called seanwilliams.com.au. What about yourself?
And you can find myself on Facebook at Sasha. Alrighty, so today we're going to be talking about diabetes and kidney disease. So first of all, what diabetes is, it's a group of diseases which is categorized by excessively high levels of blood glucose or blood sugar. And it's important to know that there are a few different types of diabetes. The most common ones are type 1 diabetes, which is juvenile onset, so it happens in younger kids, children onset. It's autoimmune, often categorized as autoimmune disease, and it sort of contributes to around 10% of overall diabetes. And type 2 diabetes is really the big category of diabetes that affects a lot of the population. And that's a lifestyle, adult onset, diet-related, sugar-related type of diabetes. So, just before we get into it, I just wanted to share a few stats around diabetes because it's really affects a large proportion of our population. Approximately 1 in 11 people worldwide diagnosed with diabetes. And that's diabetes, right? There's also being pre-diabetic, which I don't have to get into that, but I think actually it accounts for even more people pre-diabetic than they are diabetic. So 1.2 million Australian adults are diagnosed with diabetes, which is approximately 6% of the population. So it's 1.2 million Australian adults who are diagnosed with diabetes. And it also has a greater prevalence in lower socioeconomic areas, which is interesting. So type 2 diabetes is greatly impacted by diet, physical activity, which we're going to be talking a little bit more about diet, activity, stress as well, which Sean will go into in a moment. And it's often associated with those high levels of sugar, blood glucose levels, often associated with other conditions which factor into metabolic syndrome, which maybe you can share a bit more information on shortly. And then the consequences of diabetes, if left untreated, things like blindness, strokes, amputations, heart disease, and then what we're going to be talking about more in this video is kidney disease. So before we get into that stuff, so why don't we give us a little bit of information from a naturopathic point of view around diabetes and type 2 in particular, which is what we're going to be focusing on, so type 2 diabetes.
Type 2 diabetes. So first of all, I think everyone understands that type 2 diabetes is entirely diet and lifestyle related. So if we talk about the lifestyle related issues, you have, say, like lack of exercise, stress. Stress is a big component because the stress mechanism actually jacks up your glucose levels. So what happens is when you stress out, you go into your fight and flight mechanism. The hormone that is associated with the fight and flight mechanism is cortisol. So cortisol does one very important thing. It stimulates your liver to convert stored glycogen or stored glucose and return it to the bloodstream. So when you're in an extremely stressed situation, or if you're an extremely stressful person, you're always going to have this elevated blood glucose levels. As soon as that happens, you're going to have high insulin levels. As soon as that happens, there's your phone. But yeah, that's all right. It's just the clinic phone. Just ignore it. But what happens is the glucose levels elevate due to the cortisol, and as soon as that happens, obviously, you start to get this pre-diabetic sort of a situation, and that's just from stress. So stress, cortisol jacks up the glucose levels in the blood. It also does a lot of other things as well. Cortisol is also an anti-inflammatory. The body's anti-inflammatory.
Yeah, we spoke more about that in our first episode.
Yeah, information. Cortisol. But as far as diabetes, stress is a huge component of type 2 diabetes. The other thing as well is that cortisol is released into the body as a response to trauma. So that can be like chemical or dietary trauma, these sort of things. So when you have a lot of inflammation and trauma in the body from diet, maybe excessive medication use, these sort of things, cortisol is then released as the body's anti-inflammatory,
Yeah.
and so it will jack up the blood glucose levels as well. So this is why type 2 diabetes is associated with so many different conditions. It comes as like a secondary disease in many other diseases.
Okay.
Yeah, so like you have obesity, metabolic syndrome, diabetes often turns up in kidney disease, all these different conditions, and they tend to be grouped together. And it's because as one system is affected by something, the other systems also respond in, I guess you call it a negative way.
Yep.
So diabetes is one of those conditions that comes with other conditions.
Yeah.
Yeah. So as far as diabetes, I think we all know on some level that type 2 diabetes is always dietary related. Now, for a long, long time, it was said diabetes is related to too much sugar in the diet. It's not entirely true. Actually, it's not entirely true because we've come to realize that a plant-based diet, which is a high carbohydrate diet, is one of the fastest ways to reverse type 2 diabetes. If you want to bring down the blood glucose levels very quickly, switch to a plant-based diet. So that's just, it's carbohydrates on top of carbohydrates on top of carbohydrates, and yet we're told, a high carbohydrate diet is actually what causes diabetes. That's not entirely true. We now know that high levels of animal products in the diet, such as milk and meat. So meat being a big one. So meat very high in fat, animal fat. We know that high levels of animal fats they cause insulin resistance. So there's been studies on how high levels of cholesterol, triglycerides, which is prevalent in animal meat, they block, they create insulin resistance in a lot of people. So there's also a way that happens.
Yeah, and that insulin resistance, that's the one component to experiencing the symptoms of diabetes. So there's receptors, they become resistant to insulin because there's so much insulin that's being pumped out all the time.
I can't remember where I read it, but I'm pretty sure the triglycerides actually block the insulin receptors.
Okay.
They actually attach themselves to the insulin resistance.
Yeah.
Now triglycerides, a glyceride is just glycerol. Glycerol is glycogen that's been in the liver, and glycogen is glucose. So glucose gets changed to glycogen in the liver, and when all the muscles in the liver are full, it then produces glycogen, glycerol, and then the body uses glycerol. It puts 3 glycerols together to make a triglyceride, and then that's how it's transported around the body and then stored as body fat. So but a lot of these high calorie diets, that's what this is from, high calorie diets, and this is why obesity is often associated with diabetes, type 2 diabetes. That's why they go hand in hand. The truth is what causes what. We know that diet causes obesity, and poor diet is I guess you could say the type 2 diabetes is a secondary condition to obesity and being overweight.
Yeah. And so just touching on as well, you mentioned with the high carbohydrate diet, and there are different types of carbohydrates as well. They're not all the same. So the type of carbs you're going to get like in the plant-based diet, they're going to be different to the type of carbs that you get, let's say, in processed refined whole grains. And for instance, the type of carbohydrate which is in wheat, it's really, really easily digested, broken down, and when you break down those carbohydrates, and carbohydrates change to glucose. And the main type of carbohydrate in wheat is called amylopectin A. It's 75% of wheat, and that gets broken down straight away into sugar, and then that sugar enters the bloodstream. It's great for that bit of energy, but unless sort of marathon runners, 20-year-old marathon runners, probably don't really need to be getting all that instant energy. And they've actually found that wheat flour, wheat sugar, wheat products of wheat actually elevate your glucose levels higher than table sugar. So the GI, the glycemic index, is a reference to glucose and how much glucose raises your blood sugar levels, and table sugar being a different type of sugar raises it less than wheat does, which is really big. And then if you think about how much wheat is in our diets, let's say a standard diet, you wake up, you have 2 pieces of toast, maybe some cereal, you have panini for lunch, right?
Yeah.
Red wheat. Dinner, you have pasta.
Head to the bakery.
Yeah, right. And the snacks, I don't know, you're gonna have some little wheat-based crackers.
Yeah.
Some dip.
Let's highlight everything that you described just then. That's not considered a healthy diet.
Yeah.
Exactly.
Yeah.
And they're all carbohydrates. This is why I think a lot of people go into the keto, the high protein, low carb diet, because it's very simple for them to comprehend what they should and shouldn't be eating.
Yeah.
When you're on a high carb, low protein or low fat, low protein diet, it's very difficult for people when they first begin to disassociate certain foods with this carbohydrate. Because when you say carbohydrate, a lot of people go, oh, carbohydrate, it's bad.
Yeah.
What we have to understand is everything in your produce section, from fruit, vegetable, this is a carbohydrate.
Yeah.
And so, there's this misconception about what carbs are. When we talk about carbs, we talk about everything that pretty much, I guess you say, contains gluten. And that is your pastas, all your bread, bakery style foods. These are all gluten. Cereals. Yeah, cereals. Just to highlight this, rice doesn't contain gluten.
Yeah.
So rice is still on the table in a lot of these. I guess in a way that you reverse diabetes, you can continue to eat rice.
Yes.
It's very good. I mean, you've only got to look at everything north of Australia, in the whole Asian region and the whole Asian continent. They're big rice eaters. And until the Western diet came into their society, they were big rice eaters, and they're all in perfect health. So.
Yeah, and that's it. Like we were sort of speaking at the start, it's a Western lifestyle disease, essentially. And just sort of going back on the gluten and the wheat topic, because for some of my friends who've been watching this, like, I've been one of those gluten-free people for pretty much gluten-free people for a long time. And then looking now, because gluten-free has become such a big thing, you can go to the supermarket and you can get all your favourite gluten products gluten-free.
Yeah.
But then if you look on the back and what's actually in those gluten-free products, the ingredients they're not really about promoting health or healthy diet.
Yeah.
And a lot of these things are just other processed grains or other processed food items, essentially, which also spike up your blood glucose level. So instead of getting your intake of carbohydrates from the gluten-free products, which aren't going to be promoting a healthy diet, why don't you get your carbohydrate intake from fruits and vegetables?
Absolutely. Gluten's really interesting. 20, 25 years ago, gluten was not an issue.
Yeah.
Very few people were gluten intolerant. But what's happened is we use so much pharmaceuticals, and we consume so much which our body or our GI tract considers poison, that we've effectively compromised our GI tract. So a lot of things like gluten, casein, all these type of proteins which are foreign to the body, but our GI tract is able to break them down enough.
So where's casein found?
Casein is a milk protein. Milk, so it's milk, dairy. So you got casein, which I believe is actually what lactose intolerance is.
Yeah.
It's actually casein intolerance.
Yes. Even if you are lactose intolerant, if you're not lactose intolerant, there are, I think it's like 1 in 10 people are actually lactose intolerant. You're still exposed to that casein protein.
Yeah. And so what's happened is our lifestyles have compromised our GI health, our gastrointestinal health so much that a lot of these foreign proteins, which are naturally broken down into something that our body recognizes in the gut through digestion, they escape through that GI, I guess you call it barrier, and then gets into the bloodstream and into that abdominal cavity, and the body just doesn't recognize it. It just, what's this gluten, what's this casein, I don't recognize it. And so it initiates this almost like an autoimmune response to it. And starts developing antibodies.
Yeah, and that's really quite interesting you mention that autoimmune response, because there's an author, he's a medical doctor, William Davis, who wrote the book Wheat Belly, which is a really great book. A lot of information is in the Wheat Belly. And, he talks about how removing, well, not him, but there have been studies, and he talks about it as well, removing wheat from the diet can actually help to reduce some of the symptoms or even reverse some autoimmune diseases. Yeah, which is Yeah, quite interesting.
Definitely, because autoimmune is simply the body creating antibodies, and it's attacking itself.
Yeah.
So very often, I believe, we get these microscopic particles of gluten, protein, casein, protein, and every other kind of protein which is designed to stay in the gut and be broken down into amino acids.
Yep.
They escape through that intestinal barrier into the body, into the bloodstream.
Yeah.
And we have these foreign proteins which the body doesn't recognize, and that's what happens.
Yeah.
So getting back to diabetes.
Yeah, because you sort of.
Yeah, we got tangent.
Yeah.
I always go off on tangents. It's my thing. I'm the tangent king. So with diabetes, reversing diabetes, because we like to give actionable advice here, where you can actually use what we are talking about to improve your health. So in my practice, it's a very simple process. First thing I do is I take out all animal products. I take out all manufactured products. So that looks like I remove all the beef, chicken, and the fish. I remove all the pastas, all the bakery goods, all the breads, anything like spreads, pretty much anything that's in the center part of your supermarket. As you walk into the supermarket, you have a produce section, you have a frozen section, and then somewhere in the middle you have all your manufactured foods. So cereals, your sweets, chocolates, you have your chips, and you have all your snacks, canned foods, pastas, rice, things like that. I tend to tell people to stay away from the center and to stay in the produce section, and you're fine. What does that look like? That is fruits and vegetables. First, you want to do something like this for about 35 days, and you'll notice. The first thing you'll notice about 5 days into a diet like this is your blood glucose levels will drop. So you're going to have to watch that, because if you're on metformin or glucagon, you're going to have to go see your doctor, because they force, probably the correct word, they force down your blood glucose levels through different mechanisms, which I won't bore you with and go into, but they push down your blood glucose levels. So when your blood glucose levels normalize, that metformin or glucagon that you're taking is going to push your glucose levels low, and that's dangerous. You can go into diabetic comas, you can pass out, all sorts of problems. So when you do change your diet, you need to let your doctor know within those first 5 days, because you will be getting readings below 2s, 2.5 and 2s. So be careful. Be prepared for that, I guess is what I want to say. You're going to lose weight. That's normal, and that's a good thing. Everyone wants to lose weight. This is one of the great things about a plant-based diet, is you lose weight. Everything you're eating is very low or negative calorie, so very low, and you can still fill yourself up and still remain well below the daily calorie intake. What the Australian or the American Dietitians Association recommend for a grown man or woman to have per day. You can stay well below that. And weight loss is a numbers game. The idea is to be below your daily energy requirements. If you're below your energy requirements, then you're burning body fat. Exercise is always good. Exercise is really good for 2 reasons. It I guess stops and then reverses the stress mechanism. So if you're in your fight and flight, you've got cortisol and adrenaline, obviously, but cortisol's the hormone. So if you're exercising, you're neutralizing that cortisol, and so you're removing the mechanism which is jacking up your blood glucose levels. Obviously, there's still the dietary side of it, but if you're on a plant-based diet, you're slowly starting to remove that. So 35 days, but exercise will, within half an hour of exercising, the endorphins will kick in, and so a few things happen. Like I said, your blood sugar will drop, because in this fight and flight mechanism, your body thinks that you're going to run or you're going to fight, and so it produces all this glucose into the blood, thinking that you're going to need it. And so what happens is, through exercising, you're burning off all that glucose. So you're utilizing it, and so the body's like, yes, this is good. We utilized it, good. And then the negative feedback systems, I guess, that stop the cortisol production through exercise. So you stop exercising, your body's like releases endorphins. The body goes, okay, the exercising is over, the stress is over, we've run away or we've won the fight, and so it brings down the cortisol levels back to normal.
Yeah.
That's why with anyone who's in a stressful job or stressful situations, that's why they always say exercise works really well.
Yeah.
It isn't some arbitrary thing, it actually works on a physiological level.
Yeah. Yeah, for sure. So, sort of recapping on what we spoke about, stress increases cortisol and increases blood glucose, which is arguably good for diabetes. So stress level, modify how you cope deal with stress. Don't stress about things that you can't really change. And then point number 2 is pretty simple, just walk past that little part of the section of the supermarket, go straight to the fruit and veg section.
Exactly.
Yeah, and then on that as well, if you're replacing your calories with nutrient-rich foods like vegetables and fruits and nuts and seeds, then not only are you're not getting the negative effects of those poor foods, but you're also getting the positive effect of eating more nutrient-rich foods.
Absolutely. So, especially fruit. Fruit is like medicine to the human body. It's amazing. A lot of fruits have something called astringents in them. It's a plant medicine. It's probably the easiest way I can do it. It's an active constituent in herbal medicine, and it has a really interesting effect on the GI tract in that it binds with the proteins in the GI tract membrane, and it hardens it and it allows it to peel off, so you can get rid of like mucoplaque on the bowel wall. A lot of the fruit have soluble and non-soluble fiber in it, so it goes through, and the soluble fiber scavenges all the free radicals throughout your bowel and all the poisons and that, and helps to remove it.
Yeah.
So it's really good stuff. It's like medicine on so many different levels. But the astringency is really good because it helps, once it gets out of the bowel and into the bloodstream, it works wonders. It helps to remove plaque off the walls of the artery. It does. Like we haven't been able to do any sort of proper scientific or clinical trials on anything that's astringent, because first of all, there's no real interest in it because it's available in everything from fruit to herbal medicine, so it can't be put into a pill and sold. So there's no real funding behind it because there's no profit behind it. But it works. You take anything from lemons, limes, grapefruit. Not that anybody likes grapefruit. Pomegranate. A good one is dark grapes.
Yeah.
Dark grapes are very, very astringent. Anything like that will work perfectly.
Yeah.
But in the vegetable department, a lot of herbal medicine is actually just vegetables. In fact, the FDA and for us the TGA, we classify a lot of herbal medicine just as like plant, just as supplements. They come under food and beverage, I think it is.
Yeah, right.
So it's different classification. They're not classified as pharmaceuticals.
Yeah. So if you're making these changes, improving your body's ability to cope and manage stress, you're changing your diet, keep in mind that you're consulting your naturopath, your medical doctor, your GP, doing more exercise. You mentioned that you can find some of those what do you call it, particles from fruit? The astringents.
Astringents,
in herbal medicine. So are there any herbal supplements, any herbal supplements that can work in conjunction with this?
Absolutely. So for bringing down blood glucose levels, you want things like fenugreek seed. Like fenugreek's just a kitchen
spice.
I'm
seeing the spice of it, aren't you?
It's just a kitchen spice, fenugreek. You'd obviously need therapeutic grade to have any sort of effect, but I mean, you can go to a pharmacy and find fenugreek in like Nature's Own, Thompson's, Blackmores. They all have it because it works, and it brings down blood glucose levels. If you have gestational diabetes, for example, this is great because it's completely harmless to your child. It won't hurt your child in vitro, but it will help to manage your blood glucose levels. I have a few ladies on fenugreek seed right now, and having
Because that's something we really talk about gestational diabetes, but that's interesting to know.
But it's really it's interesting because, and even me, like I've been practicing now for 6 or 7 years, and there are still moments where I just get shocked. I get messages and it shows me the blood glucose level monitor, say a couple of days ago, and they're up there in the 6s and 7s readings, and that's high. That's high. It's dangerously high for anyone, let alone a pregnant woman. and they take the fenugreek seed, and within like 24 hours they're down into the 5s.
Wow.
Then they drop down into the 4s, which is, doctors usually very happy.
Yeah.
Although a lot of the times they don't tell them that they're on it.
Yeah.
So the doctor thinks they're taking the metformin and it's working, and they haven't touched the metformin. So yeah, if you are doing it, please let your doctor know. If you have a doctor who responds negatively to something like that and tells you not to do it, that's a clear sign you need a new doctor.
Wow.
Time to find a new doctor. Because a lot of doctors are moving towards this supplement sort of a mentality, and they're more than happy. A lot of doctors are more than happy to, for you to supplement as you take medication. If you do decide to do something like that, see a naturopath, because we're all trained in pharmacology and especially in your drug-herb interactions, so we're very aware of what can go with what and what can't. So if for no other reason, if you're planning on going natural and maintain, and for whatever reason you have to maintain yourself on a pharmaceutical, come and see a naturopath, and you can save you a lot of heartache.
Yeah.
Because there are some herbs that react really badly with medications.
Yeah.
Especially things like warfarin and things like that.
Yeah.
I know that's not really related to diabetes, but if you're on something like warfarin, aspirin, and things like that, then you
consult somebody.
go see a naturopath, because a lot of herbal medicine will cleans the blood. I guess the most simplest way I can put it.
Yeah.
So it may actually increase the effects of the warfarin, and you may have hemorrhage. So please be careful.
Yeah. So fenugreek. Anything else in particular you think would?
Any sort of ginseng works really well with diabetes. Gymnema is really interesting because it's a herb that you put on your tongue, and it doesn't just manage, or you can take it as a normal herbal medicine. It's another one that brings down glucose levels as well, but it takes away the sugar taste. So if you drink anything that's sugary, it will taste like sand.
Okay.
It literally it doesn't have any taste. It's the strangest thing I've ever come across. I don't use it much myself because I use fenugreek. A lot of people prefer fenugreek.
Okay.
Yeah, it's really interesting.
Yeah.
I remember when I was in clinic doing my studies, and they'd like to tease me. At the time I was a big Coke drinker, which I don't do anymore. But they used to put it in my mouth and then make me drink Coke, and it would just have no taste.
Yeah, right. That's really
Completely
interesting.
devoid of taste.
Yeah.
Yeah, really interesting. Yeah, I think off the top of my head, that's about all I can come up with.
Yeah.
Because I primarily go to fenugreek.
So it's like sort of
it's my go-to.
Yeah.
There'd be other practitioners watching this, and they're probably like, what about this? What about this? But I've got to be honest, fenugreek always sticks out to me as the one to go to.
Yeah. And then, like I've spoken to people who have reversed their type 2 diabetes. There's lots of health documentaries documenting it as well, and there's research as well documenting it going on a vegan, vegan, vegetarian, refined carbohydrate, refined sugar, removing red meat, white meat, plant-based diet. There's a lot of research on that as well.
Absolutely.
How, because it's a big change, right?
It is.
Especially if you've been stuck, because you didn't just develop diabetes overnight, right? You've been doing things which your body hasn't been appreciating for a long time.
Decades.
You've been really poisoning your body for decades, right? And probably you've been poisoning your body through poor diet, lack of exercise, and you've been eating all those things that we said maybe avoid to eat, right? So instead of going to the food and bed section, you've probably gone straight to the center part for the last 20 years of your life, right? So how easy or difficult is it to start to make those changes, or to make those changes? And what effects is it going to have on your body?
So the first thing that's going to happen is as soon as you change your diet, you'll go into something like detox.
Yeah.
Your body immediately throws itself in detox, especially when you take away the meat and the milk, because the body naturally wants to detox. It does it constantly at some level. But when you take the milk and the meat away, your body goes into a higher level of detox, especially when you're on a fruit and vegetable diet. When you begin that, even to just introduce more fruit and vegetables into your diet, the natural plant medicine in the fruit and the vegetables will throw your body into detox. This isn't a particularly nice experience. For a lot of people who've been on high sugar diets and a typical Western diet, you'll get everything from diarrhea as the body begins to cleanse the GI tract.
Yeah.
You may get headaches, constant headaches, and this will be withdrawals from the sugar.
Yeah.
You'll get cravings for sugar, and that'll be the parasites wanting their sugar, and the fungus and the yeasts wanting you to feed them.
Yeah.
So you have to be really strong. And the meat's not usually a problem. A lot of people have this mental thing around meat, but after a few weeks of being on a plant-based diet and they see the effects, it's not a problem. The problem is the sugar.
Yeah.
Because there's a whole ecology of things inside you, parasites, who are going, why aren't you feeding me?
Yeah.
Because the fruit and the vegetable is so easily digested that there's no leftovers to feed fungus, yeast, and parasites. And so they do literally they produce chemicals and hormones out of themselves into your body that signal, I want sugar.
Yeah.
That's what it does, literally what it does.
Yeah.
So, yeah, it's interesting. But as far as difficulty, some people find it really difficult.
Yeah.
Some people it just depends on the personality. You have very disciplined people who can make changes that day.
Yeah.
I've met people who I never ever thought would be able to do it, and you don't think they're really taking any of the information in, and next time you see them, you can see that they've taken everything on board and they're doing it.
Yeah.
And then people who, you're like, this person's got it, this isn't going to be a problem,
It's the opposite.
and it's the opposite.
Yeah.
So it's so hard to pick. Discipline is the big thing, consistency is the big thing.
Yeah.
Getting through the first 2 weeks is the hardest.
Yeah.
What I refer to as that period is, refer to it as a transitional period, and I just say whatever that needs to be, because for some people it's like a day, some people it's a fortnight, some people it's like 6 months, and I've had people who've taken 12 months, and they finally are like, yeah, I'm 100% off everything, and I should have done it 12 months ago, like you said. I've done it, and I feel so much better. But that's just how, it's just how people are. Some people are very emotionally attached to food. Food is a big part of who they are. They come from cultures and families where food is a big thing, and so they have their entire psychology is based around food.
Yeah.
And changing that is big. Other people are like, I forget to eat.
Yeah.
Eating, I eat once a day. I'm like, why do you eat once a day? Because I forget.
Yeah. And that culture thing is a big thing because I'm part Italian.
Yeah.
So before we actively make a lot of these changes, and it was like exactly what you said. It was like a transition period. We didn't go as a family like cold turkey on day one. Although there were points where we did go to cold turkey on some things, but it was like a transition period. It's pretty hard to be Italian and to give up pasta, bread. Yeah. It's like the staple part of the culture. It's pretty hard to.
Thinking about it, my clients who have the hardest are the French, the Italians, and the Sicilians.
Yeah, as we're down south as well. So, but I remember when we it was quite a while ago. We were making these changes, becoming more aware. You actually find all the other food items that are out there. You start cooking these different things, and you start getting like tastes of different foods that you would have them otherwise you never tasted or touched in your life. So you're opening up that side of things as well.
Yeah.
All these different flavours and foods that you wouldn't usually have. And they're so much richer and deeper in their flavours and what they offer you.
Yeah. Before we go on to kidneys, there is one thing I have to address, which we haven't addressed, and that is the diet and the low fat industry.
Yeah.
So everything that is low fat or zero sugar has something called aspartame in it, and that is a very dangerous, very neurotoxic chemical that I'm not sure where it comes from, to be honest with you, but the FDA and the TGA both labelled it as I guess you call it carcinogenic and neurotoxic. So my advice is if you are diabetic and you're on these diet sodas and you are on low fat yogurts and things like that, just get away from them. First of all, you shouldn't be drinking any sort of soda. Maybe soda or water. It's just carbonated water. Anything like that. If you can get your hands on any sort of alkalized water, like is it Evian water? Like you can buy, it's expensive. If you can get hold of this Kenyan water, it's like a unit that goes on your kitchen sink and produces, I think it's 8 to 9.5 pH water, anything like that. There's so many different companies out there doing it.
Yeah.
I remember Kenyan water from when I read a book by Dr. Young, I think his name was. Yeah, he goes to training.
That's right.
Yeah, but anything by Dr. Owen Young, he talks about it. He wrote a book called The pH Miracle back years ago. He's poor man's in jail right now.
Is he?
Yeah, the AMA, the American Medical Association, they put him in jail for malpractice because he was using alkalized water to cure cancer.
Oh.
So I shouldn't use the word cure, but that's what he was doing, and he was claiming it too. So he had to run away to Italy. He was there for 5 years, I think, and then they eventually deported him back to America, where the AMA put him in jail for malpractice. But alkalization, I mean, you've heard everyone talk about alkalize. It's like detox.
Yeah.
It's the same thing. A lot of these conditions are acid-based conditions, and so alkalizing does a big, helps a lot. So anything like these sort of waters, they're preferable to sodas. Anything you find low fat is usually high sugar, and anything that is low sugar is usually a natural sweetener, which is aspartame. So be aware of that. If you are diabetic, usually type 2 diabetic, and you're drinking these sodas, you're creating a whole other problem off this side. You may be assisting in the diabetes. Well, I say assisting, but in fact you're creating a whole other problem over here. So be aware of that.
And I heard this analogy not so much for soda and diet sodas, but it was more for like wheat and whole grain wheat, and it sort of applies as well. It was a bit crude, but it's like you've swapped your regular out of packet cigarettes for your little rolling cigarettes. You just swap one really, really bad item for a slightly less bad item. It doesn't make anything better. You're still putting bad things in your body, essentially.
Stay away from them. Do what you can to stay away. And very often, I'm pretty sure aspartame has been associated with weight gain, obesity, and even type 2 diabetes. So be aware of that. So plant-based diet, bit of exercise, reduce your stress or manage your stress. Diet is the big one. It is the big one. Get away from the Western style diets. Try and find your way onto a plant-based diet. Stay away from the sodas, the diet sodas, things like that.
That stuff. And then it's not going to be easy as well, right? Consult your naturopath.
See your doctor about it, especially like I was saying, if you change your diet within those first 5 to 7 days, your blood glucose levels are going to drop. So watch out, because if you're on metformin, glucagon, or intramuscular insulin, your blood glucose levels are going to drop. So be careful. That doesn't mean you should fear, not do it. 100% go do it. But be aware. If you're type 2 diabetes, you usually have a blood glucose monitor. As those glucose levels are coming down, look in to see your doctor and have yourself either titrated off the metformin, glucagon, or insulin, or whatever, or you have your dosage managed and then reduced. Having said that, a lot of people just stop taking it because they blood glucose levels crash, and then so they go, they know what it is, so they get off the metformin, and then blood glucose levels normalizes, and they go, well, I don't need it anymore. So that's usually what happens.
And one more thing before we just talk about some community stuff as well is, it is largely type 2 diabetes is a lifestyle-related, Western lifestyle-related disease. So I hear all the time, it runs in the family, it's genetic, and just briefly, you might be more genetically predisposed to it, but that doesn't mean you're going to get it, right? It's about the things that you do in your environment, what you put in your body, exercise, your stress levels, that will tip you over the edge to then switch those genes on for diabetes. So you have epigenetics. Right. So it's the epigenetic side of things. So you have the power to decide what you put in your body, and you're really empowered to decide if you're going to go down the path of diabetes and continue to go down the path of diabetes, or if you want to make a change. And then if you don't do anything different, I say there's nothing else as well. If you don't change what you're doing now, then don't expect to get different outcomes. And you've got to change what you're doing to get different outcomes. And it's not going to be easy. It's going to take time, consistency, commitment, and repetition. Yeah. All right. So shall we briefly touch on some kidney disease stuff, because kidney disease is a really big, I want to say, byproduct or the result of poorly managed diabetes.
Yeah. So kidney disease is really interesting because it comes what's referred to as concomitantly with other diseases. It's a secondary disease to other things. But at the same time, if you flip it on its head, kidney issues can cause diseases as well. Yep. So, for example, you've got heart disease. And so when you have heart disease, there's usually kidney disease involved. There's also high blood pressure. So they say high blood pressure affects the kidneys, but in fact, kidneys are what control blood pressure. So maybe it's the kidneys causing the high blood pressure. Do you know what I mean? And so I'm not sure if we just haven't looked into it enough, or we don't have the technology to understand it yet, or maybe we're looking at the donkey's ass instead of the head, or we're checking the engine by looking at the tailpipe. Yeah. But a lot of issues stem from kidney disease, but we're often told that kidney disease stems from diseases. Yeah. Does that make sense?
Yeah.
So with kidneys, it's really interesting. So kidneys start to fail due to diet, believe it or not. Yeah. Specifically, specifically, it comes from pharmaceutical and that's not dietary related, but I guess you could say it's dietary related. That's more lifestyle, but dietary related, it comes from your meat and your milk and your manufactured products. So how does this happen? So when we take a lot of pharmaceutical medicines, as I said before, the gut breaks down, the integrity of the gut barrier breaks down. All of a sudden, things can escape through the gut wall because the mucosa is broken down and it can't maintain its the environment of the gut. Inside the gut begins to leach out into the blood, into the lymph, into the abdominal cavity. And we've spoken about this in other videos. Yeah. What happens is when things like animal protein, we have other things like your gluten, which we spoke about before, casein proteins, all these things, they make their way into the blood, and the first thing they come into contact with, is the kidneys. So that's the first thing that happens. Kidneys come in contact with all these foreign proteins, and what happens is the proteins are big enough that they block the filtration system of the kidney, which is called the glomerulus. So the kidney is made up of the main artery in, blood artery in, the main blood artery out. So you got your waste product coming in, and then your clean blood coming out, and then you have this glomerular filtration unit, which is what the blood pushes through, and that stops certain things from going through, like proteins, but everything else comes through, like your minerals, your glucose, and your acids, things like that. They all go through the.
Is it almost like a sieve?
Yeah, it's exactly like a sieve.
Okay.
You know, like your pasta stays on top, and everything else comes through. So imagine that colander full of pasta is protein, and eventually, you get too much in there, it's going to block up. It's going to reduce the filtration mechanism of the kidney. Now, when that happens, your filtration rate begins to drop. When that happens, your creatinine levels, which is a muscle metabolite, increases. This is how we know if you have kidney problems. We look at a blood test, we look at your creatinine levels, we look at your albumin levels, these sort of things, and they tell us that your kidneys are not working. When they become elevated in the blood work, it means your kidney function is going down. We can also look at it's called your EGFR, your estimated glomerular filtration rate, on a blood test, and that tells us how your kidneys are going. But as soon as that happens, we get these alarm bells going off. So one of the first, the first symptoms of kidney issues is elevated blood pressure. So that's one of the first things. So, and that's a cardiovascular risk factor. So what happens is they start looking at your heart, and they go, oh, there's something wrong with the heart, maybe there's something wrong with the vascular system. It's kidneys. Your problem is your kidneys. Other things that cause kidney diseases, medication, believe it or not. So antibiotics are a big one. So you have like your streptomycin, I think that's what it's called. I'm not sure if penicillin does it, but I know that some of your other ones do, erythromycin. There's also your non-steroidal anti-inflammatories, that's your ibuprofen, naproxen, your steroid anti-inflammatory, which is your prednisone. These all affect kidney function.
Yeah.
The big one though is, and a lot of people don't realise this, here in Australia we call it Panadol.
Yeah.
So things like paracetamol. In America, I think it's Tylenol.
Not sure.
Yeah, I think outside of Australia, a lot of the paracetamol type analgesics are called Tylenol. So I believe Tylenol is one of the most sold products in America.
Right.
And it's just like paracetamol.
Paracetamol.
Yeah.
And how common is it people just take paracetamol?
Yeah, well, I remember when I had my daughter, I'd have family members bring me up and I'd be like, oh, she's suffering from this, or she's got that, or maybe she's teething. They'd be like, just give her Panadol, just give her Panadol, just give her Panadol. That was like the solution to everything.
Yeah.
Give her Panadol. Like, oh, okay. But now, that's 17 years later, I understand, like, that's the kidneys.
Yeah.
Affects the kidneys. Yeah, so another big one is any sort of blood pressure medicines, so it's like your ACE inhibitors and things like that, which is really interesting because poor kidney function is what causes high blood pressure, and then they're actually giving you blood pressure medication, which then affects the kidneys.
Yeah.
It's like this vicious cycle.
Yeah.
It's amazing. The way that diet affects kidneys, it isn't just like with the protein blocking that glomerular filtration rate.
Yeah.
We also have atherosclerosis as well, which is the clogging of the arteries. So as the arteries clog, just like everything in the body, the kidneys don't receive enough blood flow.
Yeah.
So not just going into the filter, but actually to the actual kidney, and so that the kidney begins to experience hypoxia.
Right.
And a lack of nutrients and things like that, which hypoxia is a lack of oxygen.
Yeah.
But that begins to become a system-wide issue.
Yeah.
Another really bad one is warfarin. Anything that's a blood thinner like aspirin or warfarin is terrible for the kidneys. Yeah, absolutely terrible. You can see when people start getting the bruising and patching all over themselves. Yeah, that's usually aspirin. I know people who simply just take half an aspirin every day for health.
Yeah.
And yet you're wrecking your kidney function by taking. Yeah, so I wouldn't advise you do that.
Yeah, I think they're coming out with some new stuff saying they don't do that. Like,
No,
it doesn't affect on heart health. It's not there.
Yeah, 50. I'm not sure what it is. 40 years now of aspirin, and I think we've seen enough.
Yeah.
Even the medical doctors and nurses and us, they understand as well.
Yeah.
Yeah. It's like the smoking. It turned out it wasn't a good thing.
Yeah.
So but a kidney, as soon as your kidneys fail, so one of the problems we have in the medical system is that kidney failure is not picked up until stage 3.
Yeah.
So they'll see it on a blood test, and it will pretty much be ignored until you're on stage 3. At which point, you think stage 5 is like end stage. So I think it goes 1, 2, 3, 4, 5, and then end stage kidney. Don't quote me on that. But stage 3, so that puts you 2 stages away from kidney end stage kidney failure. So that's death. That's what I'm trying to. That's what I mean. There, end stage kidney failure is death.
Yeah.
Or transplant. Hopefully the transplant. But the interesting thing is our body is a self-repairing, self-rejuvenating and regenerating system. We can rejuvenate and regenerate. And so that's all we have to do is take away these things and then replace it with other things, and the kidneys will regenerate.
Yeah. So pretty much, you can have like 3 stages of like poorly functioning kidneys, obviously sick kidneys, until they decide to take some action.
Yeah. So the problem is that we don't really have, well, I shouldn't say we, because I'm a naturopath, but the medical system don't have anything really to help with kidney failure other than dialysis. That's their that's what they do.
That's once you're on dialysis.
Dialysis. Once you start dialysis, you stop urinating, and then the kidneys just shut down.
Yeah.
They just shut down from lack of use. So with things like stage 1 and 2, and even stage 3, quite easily reversible. It's because it's all dietary related. So if you want to reverse it, diet. Get rid of the animal protein and the milk and any form of dairy, including eggs as well, get rid of all that and go on a plant-based diet. Once again, this sounds so redundant and so arbitrary because we just talked about this with diabetes, and guess what? We're talking about it with kidney failure.
Yeah.
Because it's all the same thing.
Yeah.
It's all exactly the same thing. But you get on a plant-based diet, you go especially high on the fruits. Now, the thing you have to be careful with is if you are in stage 4 and end stage, you're probably not going to be urinating, and so you're going to need a little bit of assistance. If you're, how can I explain this? If you're not urinating, it's going to be very difficult and very taxing on your body to eat foods that are very, very high in water content.
Right.
So that's fruit and vegetables.
Yeah.
So it's going to be interesting. So you're going to have to try to reverse that kidney failure from stage 4, 5 down into stage 2, 3. You need, if you can urinate, even if you can get a couple of drops out, you're still urinating, you're still producing urine, you can reverse it.
Yeah.
After that, I usually don't give too many guarantees.
Yeah.
But the problem is that we're not catching it early enough. So stage 3 is reversible, but like stage 1 and stage 2, once your creatinine, your bun levels, urea levels, and things like that begin to rise, and your estimated glomerular filtration rate begins to drop. Like, you just got to take action right then.
Yeah.
Unfortunately, very often, a lot of doctors, most doctors are not trained to think of it as significant until you're in stage 3.
Yeah, and so that's something that someone can bring to you.
Absolutely.
Have a look at it, something that you'll pick up on.
Absolutely.
On their results. And then what would lead somebody, let's say stage 1, 2, even 3 kidney failure, what would lead somebody to get those tests done in the first place?
Skin conditions are a big one.
Right.
If you have any sort of skin condition, there's a fair chance there's a kidney issue there.
Yeah.
So we talk a lot about skin conditions being related to gut health and diet, which once again there's 100%. But a lot of people forget about kidneys. Yeah. In herbal medicine, kidneys are really easy to treat. We have this thing called nettle seed, stinging nettle seed.
Right, the one that you find in the garden.
So stinging nettle seeds, not the leaf or the root. So the root is for prostate, and the leaf is really high in iron and really good for the kidneys and things like that. But nettle seed specifically is a nephrotropo-restorative, which means it restores the nephron of the kidney.
Yep.
In the same way that milk thistle repairs livers.
Okay, we spoke about milk thistle, I think, in our
previous one.
Yeah.
And so nettle seed is the exact same only for kidneys.
Right.
It repairs kidney function, it increases the glomerular filtration rate, and it repairs the kidneys. And so it's really important. Then you have other herbs like your couch grass, gravel root, buchu. Buchu is nice. I like the smell of buchu. It's really nice. It has a very strong, strange smell to it, but it's nice, very pleasant. I like corn silk and couch grass. Couch grass is literally your lawn, the stuff that grows on your lawn. All these things, they have different things they do for the kidneys. So we have some that reduce inflammation, some that break up kidney stones and masses. We have others that improve or reduce things like cystitis, which is inflammation in the area around the bladder and the urethra and the genital urinary tract.
Yep.
All these areas. They all do that, but nettle seed is the important one. It's very difficult to get hold of. I think I've said before, I have to get it from Romania.
Right.
I literally can't get it from anywhere else. I'd love if somebody knows where I can get it from here in Australia or nearby, but at the moment I think it's Romania that I'm getting it from. It's really interesting, and it works really well. It does. It brings back, on a blood test, it brings all your stats down. It brings your glomerular filtration rate back up. We don't know why or how. In the same way as we don't know how milk thistle works, we just know that it does.
Yeah.
We've shown it in clinic. We've shown it double blind. We've shown all this, but we haven't done it with nettle seed yet.
Yep.
But there are a few. There's one Australian herbal manufacturer who has nettle seed, and they're called PPC, the plant pharmaceutical company, I think it's called. But they're the only ones who have any sort of.
So you've got it. We can get it from you.
Absolutely.
And one more question as well around that. So if you know, maybe if you're pre-diabetic or if you're diabetic, you should be thinking about your kidney health as well.
Absolutely.
Yeah. And so let's say you are pre-diabetic or diabetic. Is it worthwhile to get your kidney function results tests back and then bring them to somebody like yourself to see where your kidney function's at?
Yeah, definitely. And especially like type 2 diabetes, yes, definitely diabetes actually affects kidney function.
Yeah.
It's part of the whole mechanism. Kidneys are often a big problem, along with another huge list of other issues from, peripheral neuropathies, blindness, like you're saying before. You can have a loss of limb.
Heart issues, stroke.
Big issue with hearts, and liver toxicity as well. And there's lots of, but if you have anything from heart disease, if you have had a stroke, any of these pre and post event, cardiovascular and cerebrovascular, which is stroke. If you have any sort of autoimmune disease, anything like that, get your blood work done, and then have a look at them. You don't even need to go to a naturopath. You can literally look at the ranges, and if you're mid to high range in anything to do the kidneys, that's an indication you can start working on your kidneys. Because once you're outside of the ranges, because when you get a blood test back, on it will have all your stats, and then at the end it will have your ranges. Like whatever country you live in, it'll have the ranges. Because believe it or not, they're different. There's no universal thing. In fact, sometimes they can change from pathology lab to pathology lab. Right. So you can have, here in Australia, we might have a Melbourne pathology lab, you might have a Sydney and then a Brisbane one, and they'll have 3 different ranges. But they're all similar enough that they're not hugely different. But you can check your own ranges. Like, be proactive on your own health. Don't just take what your doctor's saying for granted. Take your paperwork home with you, because then it's yours. And if you see any practitioner, it doesn't have to be a naturopath, it could be anything, chiropractor, you could see an osteopath, you could see a homeopath. They're all trained to read, most people are trained to read a blood test, but you're looking for your urea, creatinine, your BUN, B-U-N in capital letters, and your E, small e, GFR, all in capitals. And these are your kidney results, and check them. And if any of them are coming towards the higher part of what's called the normal range, you've got to understand, once you're outside of those ranges, you're in stage 3 kidney failure. So if you're getting high within those ranges, then it's time to start.
Do something about it.
Check what you're doing. Check your diet. Check what you're drinking. It's a big one. Check what you're doing. And make some adjustments. Make some big adjustments. Something as simple as dandelion tea, nettle tea. It probably tastes disgusting, but they're never particularly.
You're not drinking them for. You're not drinking the taste of it. You're drinking the function.
Teas will work just as well, because first of all you're consuming water, and then you've got the medicine in the water. It's not as effective as a therapeutic grade medicine, which is made from alcohol. When you take something that's been put in alcohol, like a herb medicine, the most effective way to get the medicine out of the herb is with alcohol. When you do that, it absorbs straight through into the stomach, and so it doesn't go through the digestive system, it's just straight into the bloodstream. And so it doesn't have to go through that digestive process, and so the medicine's concentrated and is potent. If you have anything on that blood test that's elevated, check it out. If you're unsure, Google it. Believe it or not, Google is quite useful. Just Google it. If you don't know what an ALT is, Google it. It'll tell you that your liver enzymes. If you have elevated liver enzymes, you have liver disease. There's liver damage. Your body is breaking down liver tissue, and that's usually because of trauma. Probably drinking too much. Taking too much medication. That's usually the other one. That's the other one that does liver damage. In fact, pharmaceutical medicine is far worse for you than alcohol. Alcohol, like prolonged alcohol use, will damage your liver, but it doesn't take much to damage your liver. Medication. This is why doctors are trained for 6 years, sometimes 4 years in medical school, and 2 years post, in residency in their chosen field, because they can really they can, pharmaceutical procedures can do a lot of damage.
Yeah. So, is there anything else, particular to kidney disease that you want to share with everybody else?
The main one is reduce your meat intake.
Yep.
If you can eliminate it, get on a plant-based diet. Once again, this all sounds very redundant because we've been over and over it, but you'll constantly hear me talk about diet because, believe it or not, that is the core.
Yeah, and then so as well, if you've got diabetes, we spoke about that in the first part, changing diet, and if you've got kidney disease, change diet. If you change diet, it's going to affect both those systems.
Absolutely.
All those conditions, obviously, those conditions are pretty closely intertwined and related.
They are.
Yeah, so I guess two birds on one stone. And then as well, if you change your diet, you're getting heaps on to a plant-based diet, reducing, eliminating some of those toxic food products. And the nutrients are not just going to go to help heal those areas like your kidney, and help with reducing blood sugars as well. They're going to, the healing happens across the whole body. Yeah. So you're likely you're not just going to have an issue with your kidneys and diabetes, which we spoke about in this video, but other systems can be affected as well. Yeah, so the healing is not just going to happen in those two conditions, it's going to help heal the body as a unit.
Definitely. When you have an issue in one system, you've usually got multiple systems down.
Yeah, like we even touched on it with the gut.
Yeah.
The gut's going to heal through the gut.
Definitely.
Sorry, I interrupted you.
No, it's all good. You've got the gut, you've got the lymphatic system, you've got the circulatory system that's involved, blood pressure, and then that immediately comes back to the kidneys because the kidneys are filtered by, the blood is filtered by the kidneys. So it's all interrelated. That's why there is never like a silver bullet. There's no silver bullet because you can't treat one system, you just can't, and then expect to be well. Like you can't, for example, you can't go on dialysis to fix your kidney issues. Not that dialysis is fixing your kidney issues. What's a better example? Blood pressure. You can't fix your blood pressure without fixing your kidneys. You can't fix your kidneys without fixing your gut. You can't fix your gut without fixing your diet and your lifestyle. It always comes back to diet and lifestyle. Blood pressure, they'll give you the medication to keep your blood pressure down, but unfortunately that medicine is also destroying your kidneys, it's also destroying your gut, and it's also destroying your liver. So unfortunately, human health, as simple as it comes across, is multifaceted. You can't heal the human body with just one thing. Like for example, let's go into naturopathy. You can't heal the human body just by giving herbal medicine. If I gave you just herbal medicine and didn't talk to you about your diet and your lifestyle, we would see a small improvement, but we'd never get to what is the goal in naturopathy, which is quality of life, which is wellness, which is a remission of whatever your condition is, skin diseases, heart disease, cancer, whatever it is. To get remission in those conditions, you have to look at it from multifaceted viewpoints. So herbal medicine, diet, exercise, and move. And then you've got to have nerve innovations. That's chiropractics. You have all these different things, and this is why the natural health industry and the complementary medicine industry is holistic. You have to look at the human body from every angle. You can't just look at it from one. That's why you have chiropractors, naturopaths, and then you have acupuncturists, and then now we have functional medicine doctors who are coming into our industry as well. Because they have things to offer us as well. Yeah. Especially in the diagnostic side of things, they've got all the diagnostic tools. They can tell us, especially for me, it's all I have is symptomology and iridology, and then I can look at you as far as your physically what you look like. Your nails, your skin, your hands, your eyes, your tongue, and things like that. But to have diagnostic tools like blood tests, things like that. That's why I love blood tests. It'd be nice to be able to order a blood test, but it's not yet. Maybe in the future. The thing is, people are more than happy to just go to their doctor and get a blood test, and that tells me everything. Because as a naturopath, my main concerns are your liver, your kidneys, your GI tract, what's going on in the blood, and what's going as far as your immune system. So I always look at the erythrocyte sediment rate, which is your inflammatory markers. So those sort of things. I always check those sort of things. But what it is, it gives you an overall picture. And with that overall picture, you can start to give people advice on what they need to do. The amazing thing, I think after 7 years of practice, the diet thing is exactly the same. It's plant-based diet. Yeah. How long you do it is entirely up to you, but my advice is that you have to give it at least 3 months. I'd say 95% of people that I recommended to stay on it, because they go back after sometimes 6-8 months. They go back and they're like, oh, I really needed to eat some meat and things like that. I'm like, yeah, okay. How do you feel? They're like, I don't feel too good. Yeah. My guts, yeah. When you bring people back to wellness, it gives them a baseline to work off, and then when they start to reintroduce these poor dietary habits, that's when they're like, oh I'm starting to feel how I was when I had kidney disease, or I'm starting to feel how I felt when I had high blood pressure. This doesn't feel good. My bowel motions have changed and things have changed, and then they just go back naturally.
And you've been sick for so long, it becomes your normal. It becomes. You don't know anything else. You sort of forget what it's like to be well and healthy. And you experience that, and it's just a whole different level of living and life. And you go back to where you were, you've got something to, the baseline to compare to where you were before, to where you were when you're healthy, and you realise, maybe I want to go back to where I was, right? Yeah. So you don't want to abandon those things which made you healthy, but you're going to keep you healthy. Yeah.
Absolutely. So I guess in closing, diet, check your diet, check your medication, check your lifestyle, which is one good thing we haven't mentioned here is smoking, which do we really need to be mentioning?
No, it's pretty straightforward.
So diet, get on a plant-based diet. As far as your medications, remove anything that's not keeping you alive. Go see your doctor, see what you can get off. If your doctor's unwilling to take you off unnecessary medications, then it's time to find another doctor. There's plenty of really good doctors out there. And I'm a naturopath, so me saying that, it's rare. People say, well, I've met some doctors and have been around doctors who really are, top notch. Right, and they're actually there for the patient, and so they're willing to take their patients off medication that's no longer necessary. Whereas I've actually dealt with clients of mine who were patients of doctors, and they come in and they're on like 5-6 medications, and half the time they don't even know what they're on it for. And I've had to say to them, this is what this medication is for. You need to go back to your doctor and question your doctor. And then the next time I see them, they're on like 2 medications, so from 5 down to 2, and that's a huge improvement. Ultimately, the idea is to be completely drug-free. And that's the idea, because when you're drug-free, your body's working optimally, and this is our goal as naturopaths, is to bring you back to a place of homeostasis and balance where you don't need even our medication, our herbal medication. That's the idea, is to get you off everything. So that's all you're doing is eating and drinking, and then exercising, and that's it. That's the goal of a naturopath. The idea is not for you to be on herbal medicine for the rest of your life and to be reliant on these sort of things.
So lifestyle, diet, exercise, manage stress. And if you aren't sure if you're eating with your blood tests, or if you just want to get yourself checked out further, then you take that stuff, request a blood test, take it to see somebody like yourself, so you can have a little bit more in-depth understanding of what's going on.
Learn to read your own blood tests. Please do. It's something good, because one day you're going to have kids, you're going to have parents, and being proactive and understanding what's on that blood test it's a game changer. It means that you're actually knowledgeable and you can have an input on your own healthcare. Relying on somebody else.
Great, awesome. Now, where can we find you again, Siôn? If somebody wants to reach out to you, more information, where can we find you again?
So I'm on Facebook under Siôn Williams Naturopath. I have a YouTube channel called Siôn Williams Naturopath, where you'll see a lot of these videos. I also have a podcast called Interview with the Naturopath, which is on all the major platforms, including Spotify. And I have a website as well, SiônWilliams.com.au. So, all about yourself.
I can find myself on Facebook at Sasha. Yeah. Now, is there anything else you want to summarise or touch on before we wrap up
No, I think that's
for
it.
today? Yeah.
Thanks for your time.
Yeah. Thank you, and thank you guys for watching.
Yeah.
I hope you guys have some more take-home practical points out of today. And yeah, as mentioned before, it's going to be a journey. It might not be the easiest journey to start off with, but if you make that change, it'll definitely worth your health in the present and also in the long run. So thank you for watching, and I look forward to seeing everybody on our next episode.
No worries.
See ya.
See you.